two hip bones and the sacrum make up the pelvis. Now, the major part of the pelvis is the hip bone. Their sacrum is a different, it's a bone, and you have two hip bones. Now, what I want to say is that today we will be discussing the external surface. The hip bone it is an irregular bone and it has an internal surface and external surface. How do you identify side determination? Now, the side determination, when you take from the you just inspect and you see I am holding the hip bone in the articulated pelvis in my left. To give you an idea that the sacrum is interposed between the two hip bones. It is taking a major in the backward and the back, it is taking a place. Now, it has two surfaces, an external surface. How you identify the external surface and an internal surface? Now, the internal surface has a ear-shaped articular surface, rough, where the sacrum articulates. And also the external surface has, internal surfaces having a ear-shaped articular surface to the sacrum, to place the sacrum there. And external surface is also having an articular socket. You see it's a socket that is on the external side. So this side, and an expanded portion is the upper portion, the ilium. Now, this is which side? Right, because see the socket, the head of the femur articulates with the right femur head articulates with the acetibular cavity, acetibulum or acetibular cavity, and the expanded fan shaped is the ilium, it in the upward direction. So there are two articular surface, an ear-shaped articular surface that is articulating with the sacrum, and the acetibular cavity on the right side, on the right bone, and you see on the left side, in the left bone, you don't hold it like this. And the rough surface cannot be this way. It is not like this. It is the right side. Now, I told you evolution of erect posture, this thing. Now, the pelvis is, you hold the pelvis like this. Now, the ilium has an anterior superior iliac spine and the posterior superior iliac spine. And the upper border, Now you get a foramen, this obturator foramen. This is the symphysis pubis. This is the symphysis pubis. See the symphysis pubis. Symphysis pubis is directed medially, acicular cavity laterally, and the ilium expanded portion is this thing, and the obturator foramen anteriorly like this. And you see, this is the ischial tuberosity. If this ischial tuberosity, when you sit, you can feel it, you can feel it, you can feel it like that. Okay? And now, this is the acetabular cavity. It has a cartilage to accommodate the head of the femur. Okay? And you have read the upper limb, which joint, the shoulder joint or the hip joint, which is more stable? Hip joint is stable. You see Ronaldo kicking a goal in penalty, or you see reels, or you personally might be dancing salsa. So the free movement and things, they are in the hip joint. নাচছে হ্যাঁ, এখন এই যে মুভমেন্টগুলো হচ্ছে, ইট ইজ এ কোঅর্ডিনেটেড মুভমেন্ট, খসে যায় না। দেখবে রিলসে দেখাচ্ছে কিছু কিছু বুড়ো বুড়ি, দেখবে খুব সুন্দর একটা বুড়ি, superior border. Now there are some, now the abdomen. See, you have read in muscles, your serratus anterior, serratus posterior, external oblique and all. That muscle has to go form the wall of the vertebra. I told you the ligaments and your muscles. These are, you just feel it in yourself. You feel it, or your friend, you feel it, and the muscles. They now ligaments. Now over here the anterior abdominal rectus muscles. They get in the pubis, the pectinate line, and that the inguinal ligament. These are anterior the crest over here of the pubis, and the obturator foramen is covered by a membrane. And there is the ischial tuberosity. Oh, Baba. This is a spine developed. The ischial tuberosity. See, I'll show you a এই ছবিটা এই যে posterior aspect of the ischial tuberosity. Now, this picture, মানে I have drawn it from Gray's Anatomy. একটা অসাধারণ, সবই ওনার ইলাস্ট্রেশন তো আনপ্যারালাল। তো এটা যেন আমার সেই ফার্স্ট ইয়ার থেকেই যেন মনের মধ্যে গেঁথে আছে। এত সুন্দর ব্ল্যাক অ্যান্ড হোয়াইট ছবি, হ্যাঁ। আর এইটা দেখো, এটা বলে দিচ্ছি। নাও ইউ সি the posterior aspect, this area for semi-membranous tendon and area for biceps femoris, this part, I hatched it. Now, this is the long head of semitendinous and longitudinal ridge, ischiopubic ramus, this is the ischiopubic ramus. And this is the transverse ridge separating the two portions. You can, it is very clearly in the bone. The impression is there. You see the ridge, two parts, and lower portion is a triangle. Okay, and this is the posterior aspect you are seeing. Now, this is the spine of the ischium. Now, the posterior aspect, ischial tuberosity, edge of the acetabulum. In this part, you see the edge of the acetabulum. দুটো পার্টে, এবং এই যে এটা এরকম করে টেনে দিচ্ছি না, এটা edge of the acetabulum. This edge, this is the edge of the acetabulum.
Now let's move on to look at the muscles that produce movement of the hip joint. There are 5 muscles we're to look at: the short rotators, the flexors, adductors, the abductors, and the extensors. We'll look at the 6 short rotator muscles first, because they lie deep below the others. The short rotator muscles arise from 4 different bony surfaces: the inner surface of the sacrum, both the inner surface and the outer surface of the area around the obturator foramen, and for the outer surface of the ischium. They all converge on this small area on the back of the femur, just medial to the greater trochanter. The one that arises from the sacrum is piriformis. Here it is. Piriformis arises from here on the sacrum. It leaves the pelvis by passing through the greater sciatic foramen, along with the sciatic nerve. We'll go right round the back to see where it comes out. Here's piriformis emerging. It inserts here, high up on the medial aspect of the greater trochanter. Piriformis is an important muscle to understand because it's closely related to a very important structure, the sciatic nerve. Now we look at 2 obturator muscles, obturator interns and externs. They lie on each side of the obturator membrane. Here's obturator externus. It arises from the obturator membrane and from the adjoining edge of the ischiopubic ramus. Obturator externus passes backward, just beneath the neck of the femur. Here's its tendon, passing laterally to reach its insertion here, below piriformis. Next we'll see obturator internus, which comes around the back of the ischium here from inside the pelvis. We'll go around this way to see where it arises. Here's obturator internus. It arises from this wide area on the ilium and ischium, and from the obturator membrane. It leaves the pelvis through the lesser sciatic foramen. As it passes around the back of the ischium, obturator internus has a 90-degree turn. As it makes the turn, it's joined above and below by these 2 little muscles. We have a superior and we have an inferior. They arise from the ischium here and here. Along with obturator terms, they're inserted vertically. The last of the short rotators is quadratus femoris. Quadratus femoris arises from the ischial tuberosity here. And inserts on the femur here, on the intertrachea first. All these short rotator muscles have a set. By pulling the back of the femur immediately, they produce this movement, lateral rotation. Put us on the ground. The same muscle action produces what is a different movement. Rotation of the trunk to the opposite side. So contraction of these muscles has two possible effects, depending on whether the limb is free to move or whether it's fixed. As we see, that effect's true for every muscle that produces movement in the hip joint. Now we move on to look at the groups of muscles which produce adduction and abduction of the hip. We're going to define adductors first. There are three main adductors: adductor magnus, brevis, and longus. And there are two other muscles which adduct: pectineus and gracilis. The adducting muscles all arise from this region on the ischium and the pubis. And they're all inserted along this line. The lowest one, gracilis, right down here on the tibia. Let's start with the name adductors. Here's the largest one. Adductor magnus. Adductor magnus arises from the outer border of the ischial-pubic rings. Its insertion is in two parts, with a gap in between. The upper part of adductor magnus inserts here on the linea aspera. The lower part inserts here on the adductor tubercle here. The gap in adductor magnus is the adductor hiatus. The main blood vessels of the leg pass through here, from the front of the thigh to the back. The other two main adductors, brevis and longus, sit in front of adductor magnus. Here's adductor brevis. Here's adductor longus. Brevis arises here on the body of the pubis. Longus arises here. They're inserted on the femur, right next to adductor magnus. Brevis above, longus below. The insertion of adductor longus stops just short of the adductor hiatus. The other two adductor muscles are a short muscle, pectineus, and a very long muscle, gracilis. Pectineus is the shortest of the adductors. It arises from this line on the superior pubic rings. It inserts here, just in front of the adductor brevis. Gracilis is the most medial of all the thigh muscles. Branches here on the pubis. All the way down here on the tibia.
আমি বলি এটা নিয়ে নাও, এটা একবার করে রাতে যখন ঘুম পাবে নেটফ্লিক্স খুলো না, অ্যামাজন প্রাইম খুলো না, এগুলো দেখো, হ্যাঁ ঘুম পাবে না।
The main effect of all these muscles is to produce adduction at the hip joint. Gracilis is the first muscle we've met which crosses both the hip joint and the knee joint. We'll be meeting more muscles like it quite soon. A muscle that crosses both the hip and the knee can either act at the hip, at the knee, or both joints at once. The movement that it constitutes is determined by what other muscle groups are active at the same time. For now, we're going to look at a muscle that goes from above the hip to below the knee. We'll just look at the way it acts at the hip. In the next section, we'll take a second look at each of these muscles and see how it acts at the knee. Now let's move on and look at the three muscles that produce abduction of the hip. The two important abductors are gluteus minimus and gluteus medius. We'll go around the back to look at them. Here are the short rotator muscles.
যেগুলো অনলাইনে তোমরা যারা যারা
pelvis,
অনলাইনে ক্লাস করছো
articulation, ilium turnus, and
তার থেকে কিন্তু বেটার এটা
and piriformis. Now we'll add
তুমি
gluteus
ল্যাপটপে
maximus.
বসবে বাস ডিনার ফিনার করে একটু
Gluteus
পারফিউম
maximus
লাগিয়ে
arises from this part of the wing. It's inserted here on the front of the greater trochanter. Overlying gluteus maximus is gluteus medius. Gluteus medius arises from this part of the ilium. It's inserted here on the outer aspect of the greater trochanter. The gluteus medius is mainly an adductor, as we'll see. Its anterior part also produces medial rotation. The last of the abductors is called the tensor fascia lata. Before we look at it, we need to digress for a minute and look at the structure that gives its name, the fascia lata. The fascia lata is a continuous sheet of dense fibrous tissue that surrounds all the muscles of the thigh. Along the outer aspect of the thigh, there's a very marked thickening of the fascia lata called the iliotibial tract. The iliotibial tract extends all the way from here on the ilium Here's the iliotibial tract by itself, with the rest of the fascia lata removed. These muscles, in front of it and behind it, we'll be looking at in a minute. Between the muscles is a strong fibrous septum, which attaches the iliotibial tract to the femur. At its lower end, the iliotibial tract is attached down here.
Plastic original body, it is not this thing.
The iliotibial
Human
tract
body.
acts as the tendon insertion of two muscles.
Plastic plasticization.
Gluteus maximus, which we'll see later,
Professor Higgins.
and this one, which we were just getting ready to look at, tensor fascia lata. Tensor fascia lata arises from the iliac crest. Here, it inserts here on the iliotibial tract. The three hip adductors move the limb to the side. When the foot is on the ground, the hip abductors, pulling down on the ilium, raise the opposite side of the pelvis up. This tilting happens in a small way each time we take a step, making it easy for the opposite foot to move forward without touching the ground. Now let's move on to look at the muscles which produce flexion of the hip joint. There are four, two that act only at the hip and two that act at the hip and also at the knee. The first two are the most important hip flexors. They're called iliacus and psoas major. Iliacus arises here from the iliac crest. Psoas major from all the way up here on the lumbar spine. Here's psoas major. Psoas major arises from the transverse processes of all five lumbar vertebrae and from the sides of the intervertebral discs and the adjoining vertebral parts. You'll see its insertion in a moment. Here's iliacus. Iliacus arises from almost all of the inner aspect of the wing.
Internal surface.
As they pass downward together, iliacus and psoas major pass over the superior pubic ramus and under a structure here that we haven't been introduced to yet, the inguinal ligament. The two muscles pass downward and backward and insert together down here on the lesser trochanter. Contraction of the iliacus and psoas major produces flexion of the hip joint. When the limb is free to move, flexion brings the thigh forward. When the limb is fixed, as it is here, flexion of both hips brings the body upright. The other two muscles which help in hip flexion are rectus femoris and sartorius. They're more important for their actions at the knee than for their actions at the hip. We'll look at them briefly here and in more detail in the next section. Rectus femoris is part of a huge muscle with four heads called quadriceps. which we'll see in a moment. First, let's briefly review the muscles we've seen already. Psoas major, and iliacus, pectineus, adductors brevis, longus, and magnus, and gracilis. Now let's add quadriceps to the picture. All this is quadriceps. It's the main muscle that extends the knee. The only part of quadriceps which acts as a hip flexor is this part, rectus femoris. It's the only part that arises from above the hip joint, which is here. Rectus femoris arises by two heads, from here and here, just above the acetabulum. Its final insertion, along with the other three heads of quadriceps, is right down here on the tibia. Rectus femoris is quite a weak hip flexor. Now, we'll add the last hip flexor, sartorius. Sartorius is a very long narrow muscle that runs outside of the iliac muscle. It runs in the spiral, starting here on the anterior superior iliac spine, and ending up all the way down here on the tibia. Sartorius helps to flex the hip. It can also produce lateral rotation of the hip. Now we'll move on to look at four muscles that extend the hip. The first three, which are known collectively as the hamstring muscles, act at the hip and at the knee. The fourth one, gluteus maximus, acts only at the hip. We'll come to it last because it lies outside the others and covers them up. Here's the back of the thigh, as we saw it last. Here's gluteus medius. Here are all the short rotators. Here's adductor magnus. And here's the back of quadriceps. The three hamstring muscles all arise from the ischial tuberosity. Here they are. Two of them run to the medial aspect of the leg. One runs to the lateral aspect. The lateral one is biceps femoris. The two medial ones are semimembranosus and semitendinosus. Here's semimembranosus by itself. It has a long, flat, membrane-like tendon of origin. It arises from here on the ischial tuberosity. It's inserted here on the back of the tibia. Here's semitendinosus, lying behind semimembranosus. It has a long cord-like tendon of insertion. It arises from here, next to semimembranosus. It inserts down here on the medial aspect of the tibia, close to two other muscles that we've seen already, sartorius and gracilis. And we've seen the two semi-muscles, we'll add biceps femoris to the picture. Biceps femoris has two heads of origin, a long head and a short head. The long head arises from here, from the ischial tuberosity, along with semitendinosus. The short head arises from almost the whole length of the labia aspera and from this supracondylar line. The two heads of biceps femoris join together, forming a tendon that runs down behind the lateral aspect of the knee, then runs forward to insert here on the head of the tibia. We'll be taking another look at the hamstring muscles and their actions at the knee in the next section. We'll look at their action at the hip in a minute. But before we do that, we'll add the last enlargement of the hip extensor, gluteus maximus, to the picture. Here's the upper end of the hamstring muscles. Here, overlying this gluteus maximus, it's a thick, flat sheet of muscle. Gluteus maximus arises here on the back of the ilium, and from the side of the sacrum, and from the sacrotuberous ligament. The upper three quarters of gluteus maximus inserts into the iliotibial tract. The lower one quarter of gluteus maximus passes more deeply and inserts here on the back of the femur, on the gluteal tuberosity. Now let's look at the actions of the hip extensor muscles, starting with the hamstring muscles. Contraction of hamstring muscles can produce both knee flexion and hip extension. When knee flexion is held in check by the action of quadriceps, the hamstrings just produce extension of the hip, which is the action that propels us forward in normal walking. Gluteus maximus isn't used in a gentle action of normal walking. It comes into play where a powerful action is needed, especially an action that opposes the force of gravity. The action of gluteus maximus extends the hip from a position of full flexion, as in climbing the stairs, or rising from a squatting or sitting position. The same action, balanced against the force of gravity, controls the rate of hip flexion as we sit down. Gluteus maximus is one of the two big anti-gravity muscles of the lower extremity. The other one, acting at the knee, is quadriceps, as we'll see in the next section. Gluteus maximus has yet another set of actions when the lower extremity is fixed and upright. Then the action of gluteus maximus pulls the back of the pelvis downward, bracing the body from the forward bend of the hips, forward balanced against gravity, controlling the rate of bending forward. Now we've looked at all the muscles that produce hip movement. As we've seen, several of them also have important actions at the knee, and we'll be looking at these a second time in the next section. Internis and quadratus femoris. And here's adductor magnus, seen from behind. On the front, here's tensor fascia lata, sartorius, and rectus femoris.
Revise. Next week, টিভিয়া আছে বা যাই থাকুক সেটা তো হবেই আর একটা ডিভিশন করে নেবে এটা তোমরা নিয়ে নাও আমি বলছি তোমাদের ভাববে যে একটা সোয়েটার কিনলে অ্যামাজনে ড্রেস কিনবে না একটা পেন ড্রাইভ কিনবে I'm telling you, তারপরে কি ধরো যেটা তুমি কোনো ভালো কিছু পেলে সেটা তোমার মোবাইল থেকে নিয়ে পেন ড্রাইভে স্টোর করে দিবে আমি দেখাবো নেক্সট লেকচারটা ও কালকেই আছে ইয়ে ভেরিকোজ ভেইনস এন্ড এভরিথিং হ্যাঁ কালকে আমি তোমাকে দেখাবো কিছু ছবি যেগুলো আমি অপারেশন করেছি তো সেগুলো মানে 25 বছর আগে 30 বছর আগে সেসব অপারেশন গুলো করেছি তো সেসব ছবিগুলো আছে তো I will show you tomorrow. So you will now rarely see these pictures in the outdoor. And today what happens? People get a small problem. It is তারপরে সিম্পল সিস্টেম ওভারিং এটা আমার হেডেক হয়ে যায় আর না আমার টিউমার হয়েছে বাবু হ্যাঁ size is a simple cyst has no role role means as such it doesn't grow big হ্যাঁ তো সিম্পল cyst দিয়ে মাথা ফাটিয়ে দেবে এই অনেক আননেসেসারি সার্জারি করে ফেলছে তো এটা তোমরা রাখো কারণ তোমাদের তো সুবিধে মানে ডায়াবেটিক ফুড হ্যাঁ being treated with honey. Now what I'm telling you, you document what you find. যেমন আজকে আমি গ্রেস করেছিলাম কালকে রাত্রে দিয়ে ওই ছবিটা জাস্ট একটা এত ইমপ্রেসিভ ছবিটা সব বইয়ে আছে even astrology books they have given it diagrammatic but this you will see and I'm telling you you see the একটু মজা করে দেখবেন মাঝে মধ্যে আধ ঘন্টা এক ঘন্টায় তোমাকে কে বলতে কি বললো নাও স্টার্ট সেলফ স্টাডি কিছুটা করতেই হবে তোমাকে আর এই ভিডিওগুলো দেখো ভালো লাগবে আর একটা ল্যাপটপ যদি তোমার রুমমেটের থাকে তোমার হয়তো নেই একসাথে বসে পড়বে ঠিক আছে তাহলে লাঞ্চ